Let's talk about maybe someone who's listening or watching that has severe knee osteoarthritis or been told bone on bone or you need a knee replacement, but you're too young. Talk through success and or the good candidate for PRP and bone marrow aspirate, your kind of treatment approach for those type of individuals.
Yeah, so that is one of the things that I hate is the term bone on bone arthritis.
I thought
So,
that might trigger you.
yeah, so that's based on some certain x-ray views. We use, obviously, we look at the x-rays, we use bedside ultrasound, and you can really tell if someone truly is bone on bone or not. But majority of patients are not that have osteoarthritis, but they're told they kind of max out the conservative things. They've had a cortisone shot. They maybe have had what we call a visco supplement, like a Synvisc or an Orthovisc. They've gone through therapy. They've tried all these things. They still have pain. Well, the next stop, the next stop in the train is to have surgery, to have a joint replacement. So in the right individual, bone marrow concentrate can bridge that gap. In some people, it can keep kicking the can down the line. So when we started doing when I started doing these, wasn't even really sure how long it would last. Well, the 4, 5, 6 years out, these people are still great. Then they finally come back. They're starting to have some pain. You re-x-ray them. And the crazy thing is their x-ray is no worse than it was before. So the people that do well, medial compartment, which is on the inside. So if you're bow-legged, does better than if you're knock-kneed. So we grade arthritis from a 1 to a 4. And I always tell people, a 1's like an A, a 4 is like a D, and nobody gets an F. All right. So if you have a grade D or grade 4 osteoarthritis, if it's on the inside, my success rate runs right around 85%. And to me, success is improving pain and function at least 80% for at least 3 years. Okay. Now, people will say, what do you do then? Well, if it comes back, you can repeat it. That's a severe medial compartment. That's about as bad as it gets. Now, outside knee, if you're that severe where you're angled, about which you and I know, we call it more than 10 degrees, the outside, when it's severe, doesn't respond as well as the inside. And we don't really know why. Probably biomechanics, where's the pressure go? When I first started doing this, we didn't have as great success with those severe cases of osteoarthritis, but we found some little tricks. Some of the things are like putting a patient in a brace for a short period of time afterward, about 8 weeks. And these are just offloader braces, very functional braces, and they have hinges. You don't even know they're there. And then a few other technique changes that the audience here doesn't need to know. But by adding those special little technique changes, it upped my success rate from about a 50-50 to about 85%. And it's been consistent for all these years. And that data goes out at least 10 years. So it's definitely valid.